Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist. In today's video, we're going to go through a quick and dirty, simple tips for dealing with carpal tunnel syndrome. So if you've had some numbness and tingling in your thumb, index, middle, and maybe the ring finger, this video is for you, and we're going to do it in 5 minutes or less. Without further ado, let's get into the video. All right, so let's get into what to do for carpal tunnel syndrome, some quick and simple tips for conservative management. As always, while I'm a certified hand therapist, I can't diagnose you via the internet. Please seek advice from your doctor prior to starting any exercise program. First, let's talk anatomy. So the carpal tunnel is the flexor retinaculum or the transverse carpal ligament. It acts as the roof of this space, which contains the median nerve, which is the nerve that is getting compressed. That's the guy causing all the symptoms. And then there's 9 tendons that pass through this tunnel as well. The flexor digitorum superficialis, the flexor digitorum profundus, and the flexor pollicis longus. Those are all inside of the carpal tunnel. So we're going to go through the 3 top things to do. Number 1, checking your posture. Number 2, gentle exercises. And number 3, managing the pain and the swelling. Looking at your posture, body mechanics, your activities, all this kind of stuff is actually probably the most important element in helping your carpal tunnel syndrome get better. I would recommend using a wrist brace for sleeping in particular so that your wrists can stay in a neutral position. I would avoid repetitive or sustained gripping activities, so trying to modify your activities. For instance, carrying a grocery bag on your elbow or your shoulder instead of holding it in your hand. That's one way to do it. Keep your wrists neutral with activities. Follow those good body mechanics. If your wrists are bent really far forward or backward or sideways when you're doing activity, even if it's not very heavy, it's going to put you at increased risk for these symptoms. And number 4, check your posture and your ergonomics, not just at your desk, but just in everyday life. If your posture is really hunched forward, if you have a forward neck posture, if your shoulders are really scooped forward, really try to work on that posture and positioning. The better your posture, the less distal compensatory motions that your wrists and your forearms and your hands will have to do. And always check your ergonomics. Try to avoid hunching over or working on your couch on a laptop. That kind of stuff is probably not the best. You can also perform some gentle exercises or stretches throughout the day. Stretch around the clock in general, so every 2 hours trying to do a little bit of stretching. You can do gentle passive range of motion wrist extension. That's going to help to stretch the forearm muscles and the median nerve. You can perform this tendon gliding sequence with your fingers, again, trying to take pressure off that nerve, helping the tendons glide more appropriately and help decrease inflammation. Proximal strengthening by doing these shoulder blade squeezes or scapular retraction is very helpful. And then stretching the chest, because everything we do is forward. So doing a doorway stretch or a Brugger stretch where you're just trying to open that chest up and get a nice stretch. And you can also do some median nerve glides or median nerve flossing. That is something that you can find in some other YouTube videos, or I'll link a video in the comments in the description of this video that you can find some good median nerve glides to try. And the third tip that I have is to manage pain and inflammation. You can use ice to help with swelling and pain 2 to 3 times a day for 10 minutes, and practice changing your position frequently. When your hand starts to fall asleep and you start getting that real numb, tingly position, your body's telling you that it doesn't like the position you're in. So try to change positions, incorporate movement. That is going to be what helps to decrease the symptoms in that moment. And unfortunately, healing does take time. You do want to try these strategies for at least 4 to 6 weeks. That's consistent conservative management. And contact your doctor if there's no improvement with this consistent conservative management, or if you have other questions or concerns about your symptoms.